We're extremely fortunate to have Arianna Cruz speak to us today. Arianna is the Regional Strategy and Quality Manager at Vancouver Coastal Health. She's currently on a 2-year secondment with Cascades, which sounds really, really cool. She's supporting the quality improvement strategy performance portfolio. She's an industrial engineer with an MA in Environment, Development, and Peace, and an MBA from UBC. So Arianna, welcome and thank you for joining. Before I turn the floor to you, I do want to start off by saying that this particular area around how strategic planning is key for advancing sustainability strategy is very close to my heart. I think, in the healthcare sector, there's always competing priorities and limiting resources. And so how do you advance the agenda of sustainability? And I think we all know why that is critically important, but how do you position it so that it allows it to be in the mix of all the competing demands, not just for resources, but for bandwidth and for prioritization within healthcare organizations? And so we started our journey at North York General back in 2020 in the midst of COVID, when we launched our strategic plan 22 to 25, and we've been successful at making that as one of the pillars in our strategic plan. Now, what that does is it's not going to magically advance the agenda, but at least it puts it on a radar for from a reporting perspective, from a governance perspective, and from a resource allocation perspective. Because when anything on a strat plan will take in terms of reporting and progress, and that's a great opportunity for leaders to be able to try to position at least for some attention to sustainability in the grand scheme of work happening in hospitals. In addition to that, we've been also able to identify indicators that could go on the QIP of the organization, so the quality improvement plan. And again, this gets reported on at all levels of the organization. So there's definitely, between the strategic plan reporting and the QIP reporting, those are two great opportunities to position the work, but also ensure that there's progress and that there's line of sight from all levels of the organization up to the Board of Governors. So as again, we progressed into the new strat plan in 2025 to 2035, a lot of priorities and a lot of boxes need to compete to get on a strategic plan. And we've been, again, building on the previous success and being able to position it as one of the enablers of our strategic plan moving forward. So without further ado, I think I'd like to turn the floor to Arianna to teach us how we could do more of this and how we could leverage strategic planning in terms of advancing the sustainability strategy.
Thank you so much, Rudy. Just to confirm, you can see my screen okay?
Yes.
Perfect. Thank you so much. It's great to be here with all of you today. I'm very grateful for the opportunity to share some of the work that we've been advancing at Cascades under the leadership of Fiona with partners across the country on strategic planning for planetary health and sustainable care. So more specifically, today I'll be walking through 7 organizational practices that are featured in Cascades' new strategic planning playbook. These practices are grounded in the experience of healthcare organizations across Canada. They are informed by insights from system leaders, and they are also aligned with international evidence from national climate health action plans. And I do want to acknowledge that this work has been co-shaped with many of you. Leaders like Stuart, Lucas, and Jenny generously shared their experience and examples from their organizations. So thank you again for your leadership and partnership in this work. So as we explore each of these practices, I wanted to invite you to reflect on where your organization is today with regards to each of the practices. So practice number 1 focuses on securing visible and consistent commitment from senior leaders and board members. Historically, sustainability efforts have been led by the public health and the facilities team, but today we're seeing growing involvement from less traditional areas like quality and patient safety, signaling a broader and also a system-wide commitment. So in terms of who's leading these portfolios, public health is often overseen by a chief medical officer or a VP of population health. In some provinces like Ontario, this portfolio is managed at the municipal level. Facilities teams typically report to a chief operating officer or a chief financial officer, and then the sustainable clinical services often report to the VP of quality and patient safety or the VP of transformation. So let's take a look at how this is playing out in practice. One example is at Vancouver Coastal Health in BC. Sustainability is embedded across multiple portfolios with very clear executive mandates. So public health is led by the VP of Public Health, facilities and maintenance falls under the CFO, and sustainable clinical services is led by the VP of Quality and Safety. And a cross-cutting role, the VP of Strategy, Innovation, and Planetary Health supports the coordination of the agenda across the organization. Vancouver Coastal isn't alone. Across Canada, organizations are really assigning a clear sustainability mandate to executive leaders across a very wide spectrum of roles, from strategy, finance, communication, operations, quality, and patient safety. And this diversity is really becoming a shared leadership responsibility that's integrated throughout the health system. For this practice, some of the suggested activities for the organization include to formalize an organizational commitment to climate action from senior leaders and board members, to designate an accountable senior executive leader and/or board member to oversee this agenda, to articulate and embed the relevance of the sustainability agenda across different organizational portfolios, and ensure that our senior leaders and our board members have a baseline understanding of the importance of sustainable health systems. Practice number 2 highlights the importance of embedding sustainability into the organization's core strategic framework. We're seeing more and more organizations across Canada taking this step. Health organizations are beginning to embed environmental sustainability directly into their core strategies. However, there is an opportunity to better solidify the commitments for greater accountability, for greater action and impact. So let's take a look at a few examples. Some organizations like Newfoundland and Labrador Health Services and CHIO have taken meaningful steps by making explicit commitments to sustainability in their organizational level strategic plans. Some other organizations have taken this even further. Take IWK Health in Nova Scotia. Their journey began by formally embedding responsible stewardship as a strategic priority in their broader organizational strategic framework. And then they followed with a dedicated sustainability strategic framework, identifying 4 key areas of focus. A similar example, but in reverse order, comes from Interior Health in British Columbia. They actually started by developing a climate change and sustainability roadmap, and then building on this foundation, they developed and incorporated sustainable healthcare into their organizational strategic plan. So this really demonstrates that regardless of where the organization starts, whether it is by developing a dedicated planetary health strategy or by embedding sustainability into the broader organizational strategy, what is important is really creating a pathway that supports a sustained and explicit commitment over time. For this practice, some of the suggested activities include to conduct internal and external environmental assessments to understand the risks and opportunities the organization should be focusing on, to develop or integrating a planetary health action plan or sustainability strategy, and then translating and cascading those sustainability goals across all the different levels of the organization to ensure alignment. Let's move to practice number 3, establishing a multifunctional sustainability team, working group, or task force. For this, there's really not a one-size-fits-all approach. The structure that an organization chooses will depend on things like the size of the organization, the strategic priorities, the organizational readiness level, as well as the available resources. So we're seeing a spectrum in how sustainability teams are being developed across the organizations. At one end are the informal teams. These are typically voluntary, made out of individuals who are very passionate about sustainability and are often doing this work off the side of their desks. At the other end, we have the formal teams. These are established with defined roles, responsibilities, terms of reference, protected time. They report directly to senior leadership, and they're really integrated into the organization's both strategic and operational structures. And then in between are the emerging teams. So these often begin with a grassroots energy, but have gained some organizational recognitions. And even though all of these different types of structures have value, we believe that in order to drive that lasting organization-wide impact, the goal is to move towards those more formalized teams with well-supported team structures. So let's look at two examples. Let's begin with Sunnybrook Health Sciences Center. I'm sure all of you know about this one. They launched in 2022. They operate on a voluntary basis, but have some important formal features, like it reports directly to the VP of Human Resources. It is also linked to the quality improvement team, and that helps integrate sustainability into the operational work and the improvement efforts. Another example is Vancouver Coastal, which really demonstrate a fully formalized system-level approach to environmental sustainability. As mentioned earlier, VCH embeds sustainability into multiple portfolios, and they also have a monthly silo buster meeting with all the portfolios with a sustainability mandate to ensure that there is alignment in the strategies that are being moved forward. So for this practice, some of the suggested activities for the organization include to establish a multidisciplinary team that can inform, draft, and operationalize the sustainability agenda, to leverage and expand traditional expertise, but also incorporating knowledge and multifunctional connection in emerging areas like infection prevention and control and food services, to establish a clear communication mechanism with senior executive leaders and board members to ensure endorsement and alignment with the recommended actions. Practice number 4 focuses on strengthening internal organizational capacity. We know that building that internal capacity can take many, many different forms. Some approaches focus on building knowledge, building skills, or mobilizing resources and partnership. So let's take a look at a few examples as well. In terms of building knowledge and skills, Cascades, for example, has created many educational offerings, including an orientation course that introducing practical opportunities for sustainable action in healthcare. It has been launched by several organizations across the country and is now embedded in their onboarding processes. Another strategy is to leverage existing structures, one prime example being quality improvement. This example here comes from BC and the Physician Quality Improvement Initiative, PQI, which provides physicians with dedicated time, tools, and funding to develop their QI projects that can be focused on environmental sustainability. Another structure that could be mobilized is research and innovation, with many organizations really supporting sustainability-focused initiatives. Organizational capacity also requires resourcing and partnerships. So some organizations are using internal mechanisms like the Green Revolving Funds. This is an example from Island Health in BC that implemented a model where energy saving projects are funded through internal loans and the savings are reinvested to future initiatives. Other example comes from tapping into funds from the organization's foundations. So for this practice, some of the suggested activities include to create dedicated structures to advance sustainability initiatives or to integrate sustainability agenda into existing frameworks or structures like quality improvement, to deepen capacity in traditional sustainability areas, as well as strengthening capacity in newer sustainability areas, to develop and implement onboarding and induction modules to facilitate those opportunities for staff to share knowledge, learnings, and skills, to identify and map existing high-impact environmental sustainability efforts. We're not starting from scratch, and allocating resources for the organization to effectively carry out and operationalize the sustainability agenda. Then we move to practice number 5, which focuses on building external partnerships and networks to extend our impact, our spread, and our scale. So we know that by working with academic, community, and organizational partners, we can share knowledge, spark innovation, and scale what is working. And we're also seeing that healthcare organizations are more and more recognizing their role as anchor institutions. They have the influence that extends beyond the delivery of care through their procurement decisions, their infrastructure decisions, and they really have real power to shape healthier and more sustainable communities. A great example of partnerships in action is the Nursing Home Without Walls program in New Brunswick. This program connects hospitals with community organizations to support older adults during heat waves, helping them stay at home and avoid unnecessary emergency visits. Another example is the Provincial Sustainable Clinical Services Working Group in British Columbia. This is a province-wide collaboration, and it works at focusing on scaling the best practices, driving system-level recommendations for climate resilient and low-carbon care. So for this practice, some of the suggested activities for the organization include to establish or join networks to enable local learnings and the exchange of best practices, and to strengthen cross-sectoral collaborations and synergies to encourage a cohesive and coordinated action. Practice number 6 focuses on the importance of implementing measurement and reporting systems. In Canada, many efforts to date have been focused on emission reduction, particularly areas like energy use and waste management. However, fewer organizations are truly integrating those measurement strategies with the broader strategic priorities. We are seeing a growing range of reporting approaches emerging, including mandatory provincial reports, organizational level scorecards, and area-specific scorecards. And to make this a bit more concrete, let's also look at 2 quick examples. British Columbia offers a strong example of mandated organizational level reporting under the Climate Change Accountability Act and Clean BC Plan. Health authorities are required to report annually on their greenhouse gas emissions and climate-related actions. And the second example, I shouldn't even be talking about it because you're the experts, but it is a great example of an innovative way to evaluate whether the different organizational goals in each of the dimensions are being met. But also the Sustainability Balance Scorecard represents a great example of how to enable learning and the sharing of best practices across the network. So this is an example that's highlighted in our playbook. For this practice, some of the suggested activities for the organization include to define organizational sustainability goals and performance indicators, to ensure that the metrics and the targets adhere to any applicable federal, provincial, and local regulations, that it incorporates various sustainability performance areas, the traditional, but also the more emerging areas like food services, clinical services, infection prevention and control, and make sure that you're preparing and publishing these reports. The last practice focuses on developing strategies to communicate and engage with patients, caregivers, and communities. We know that when patients are informed and engaged, it can lead to better care coordination, to fewer unnecessary tests, fewer repeated visits, and even shorter hospital stays, all of which can help reduce carbon-intensive activities in healthcare. So let's bring this to life with one example focused on food and nutrition. This one comes from Vancouver General Hospital. They launched a project to design a sustainable inpatient menu. Their goal was to improve the nutritional quality of the meals, but also reduce food-related greenhouse gas emissions as well as waste. So as part of their co-design approach, they worked with patients and they developed together 54 recipes, out of which it led to the introduction of more than 20 new menu items reflecting both the patient preferences and also sustainability principles. And following the success of this pilot, it's now being expanded across different sites of the health authority. So for this practice, some of the suggested activities include to establish mechanisms to meaningfully engage and partner with patients, caregivers, and communities, to develop resources that help healthcare staff guide conversations with those patients, and also to co-design a strategy for ongoing and meaningful engagement within Indigenous peoples guided by principles of reconciliation and respect. So when you're assessing your organization under these practices, it is important to consider both the depth but also the breadth of the application. So first, looking at the presence of the practices, whether they exist or are they currently in place? And second, consider the scope of coverage. In other words, how widely does the practice apply across the different sustainability domains, whether it is just focused on those traditional areas like facilities and energy waste management, or do they also include the more emerging areas like clinical services, food services, etc. So to help operationalize and assess each practice, we developed a practical readiness assessment tool for leadership teams to reflect on where your organization currently stands. It isn't a scorecard, it's more to spark reflection and conversation, helping you identify areas of strength and also gaps or opportunities to deepen your work. This is the QR code that would help get access to the tool. And I just want to give you a very quick sense of how the tool works. So for each of the 7 practices, we've synthesized the recommended activities for the playbook. And then as you can see here, for each practice, you'll select the status that best reflects your current context, whether it is not started, in progress, or fully in practice. And once you've completed the self-assessment, you'll also have you'll be guided by a short reflection to get a sense of your results and start thinking about what they mean for your organization. So does the 7 practices align with your current strategy? What are the strengths? What are the gaps? What practice should take priority in the next 6 months? And then after you complete the readiness assessment, you'll automatically receive a personalized summary report by email. And this report brings together all of your responses across the different practices. And it's something that can serve as a conversation starter. So something that can be brought to leadership tables to support strategic planning for planetary health and sustainable care at the organizational level. So that was a very brief and quick overview of the readiness assessment tool, the playbook, and the practices. More explanations, case studies, and details can be accessed in the playbook. Thank you so much for your attention. And maybe before I stop sharing my screen, I just wanted to pose these 3 questions for your consideration. I would love to know if this framework or the practices resonate with your current priorities and approach, if there was any of the 7 practices that your organization currently demonstrate the most strength in, and if you also saw some gaps of or opportunities for further development.